Hi, it's Dr. Epstein. I'm with nice patients. Let me show just a little bit without showing his face. Show a little bit of how I mark out a patient for a beard transplant. This is a procedure we do quite often. We do probably 3 a week here in the office. The goal with the beard transplant is to focus the hairs in those parts of the beard where the patient feels he's most efficient. Sometimes we'll actually do a full beard with as much as 22 to 2400 grafts. Other times we'll do a more conservative procedure focusing on filling in and restoring density, which is the case with him, especially since he's relatively young. He's in his 30s, so we don't want to go ahead and take a chance that if he does develop or progresses his male pattern hair loss, we want to make sure that he has enough donor hairs to potentially be used in the scalp as well. In terms of the beard, the keys to getting a natural looking result is, first of all, the design of the shape. Something I like to go ahead and go as conservatively as patients let me, although some guys do want to go up higher on the cheek, such as, for example, to cover up acne scarring. The other key thing is angulation, having the hairs grow straight down. Third thing is the graft, the actual quality of the grafts. We're going to be doing FUE, the follicular extraction technique for extracting these grafts. It's something we do on the great majority of our beard procedures. And the goal being that we can let him continue to shave his head or cut his hair short and he won't have a visible donor site scar. Lastly, the angulation of the grafts. We want them to grow straight down. Use primarily 1 and 2 hair grafts, although in some patients with very fine hair, we'll use 3 hair grafts as they grow naturally in the scalp, but I'm very selective in whom I do that on. Let me just show you his beard. You see what I've marked out here. Basically, we're going to do the sideburn, come around the cheek, and go ahead and fill these areas in. I'm going to do a little bit under the chin, but it's primarily here. And basically I figured we're going to put in probably around 500 to 600 grafts per side, probably around 1200 grafts, and maybe another 100 or so here. All depends on how we do with his donor supply. We want to make sure that, once again, that we don't over-extract him, both for grafts to use in the future, but also we don't want to leave his scalp anything but looking good, in the future. Anyway, this is Dr. Epstein showing the pre-op of beard transplant. And I'm going to show one other video when we're actually making recipient sites, and so you can actually see how we do that, for those of you that would like to see something a little more surgical. Thank you very much.